Assalamualaikum warahmatullahi wabarakatuh, and a very good day to Prof. Lee Chutin and all my fellow friends. So now we from Group 6 would like to present about documentation in pharmaceutical industry. So the group members are Nurul Nadila, Nurul Shaza, and myself, Nur Hazira. The outlines of this presentation would include documentation, documents, records, differences between documents and records, and the examples of documentation, which include documents and records. Documentation is any communicable material used to describe, explain, or instruct regarding some attributes of an object, system, or procedure. Documentation is also an essential part of quality assurance, QA, and quality control, QC systems. It is also related to all aspects of good manufacturing practices, which is GMP. The roles of documentation. Documentation acts as a tool for information transmission and communication. Documentation is also a provision of evidence that what was planned has actually been done. It also acts as a knowledge sharing to disseminate and preserve the organization's experiences. Documentation may be in any form or a type of medium such as paper, magnetic, electronic, or optical computer disc, photograph, master sample, and many more. I would like to talk about the hierarchical documentation system. The level 1, which is quality manual. Quality manual establish overall principles and guidelines for how the company plans on developing, documenting, and implementing a current good manufacturing practices compliance. Level 2, which is the company policies. It defines the direction and aim of the company and provides a framework for establishing the company objectives. Or level 3, which is the standard operating procedures, SOP. It provides specific step-by-step instructions for performing the operational tasks or activities. And the last level is batch records, test methods, specifications, and validations. They apply to a specific department, product, equipment, or process. The examples of this documentation system will be covered on the last part of presentation. The next one is good documentation practices. Good documentation practices are guidelines that one should follow in recording raw data, entries in a legible, traceable, and reproducible manner. Good documentation practices apply to everyone whose documents activities are related to current good manufacturing practices. It is also essential for attaining ISO 9001-2015 certification and other specific ISO certifications to the pharmaceutical industry. Good documentation practices are mandatory to ensure that the documentation practices and products meet industry standards and legal requirements for safety, efficacy, and product quality. So this is the case study example of good document practices. The challenges in implementing good documentation practices are lack of proper record keeping when documents are transferred from one department to another, critical oversight regarding the document issue, data collection, and document review, and requires consistent labeling, which includes identification codes, document revision codes, product identification codes, and product lot numbers. So the solutions for the case study are to implement the key qualities of regulated documents. The key qualities are concise, legible, accurate, and traceable. For concise key quality, the information should be presented clearly so it can be easily understood with no misinterpretation. For legible key quality, the information should be readable and leave no error. For accurate key quality, the documentation should be properly reviewed, verified, and approved. And lastly, for traceable key quality, the documentation should be traceable. Make it clear who logged the information, what it was, when, and why it was documented.
What is the definitions of documents? Document is a set of paper with written or printed information of any activities in pharmaceuticals. It also defines the specification and procedure for all materials and method of manufacture and records. It should be regularly reviewed and kept up to date. Document is important because It will strengthen the quality of products and its consistency. It will also encourage knowledge sharing, which empowers the team to understand how processes work and what finished project typically look like. Next, it will ensure the availability of the data needed for validation review and statistical analysis. And the last one is, it will provide the route for auditors to assess the overall quality of operation within a company and the final products. According to GMP requirement for documents, all documents should be designed, prepared, reviewed, and distributed with care. Next, it should be approved, signed, and dated by the appropriate competent and authorized persons. It also has to be unambiguous content like the title, nature, and purpose should be clearly stated. Next, it should be signed and dated correction. Be regularly reviewed and keep up to date. And the last one is, it should not be handwritten except for the data entry. Next, we move on to record. What is record? Record is the stating result achieved and the evidence of activities performed. It enables the companies to trace all the development, manufacturing, and testing activities, and it is used to show that the operations are in compliance with GMP. Not only document is important, record also important because it will enable one to track all activities performed, and during an audit, it will help to convey messages that procedures are being followed. And the last one is, it will demonstrate that the processes are known and under control. All record also should be legible and clear, be dated, be readily identifiable and retrievable, carry authorization status, be retained for a designated period, be protected from damage and deterioration while storing, and the last one is, it have to duly recorded calculations. Next, what should be in records writing or data entry? The first one is, we should enter complete and accurate information at the time work is performed. Next, we have to enter signature of or initial, which according to procedure. Next, when one or more person complete the task, all of them must sign. And never sign your name for a job performance but actually performed by someone else. And it should limit the use of abbreviation and acronyms. And for writing on any official documents or record, we must use a non-water soluble pen and use a ballpoint pen or blue or black color to make entries, and don't use gel pens or ink pens and pencils for making entries. And the last one is, don't use pens like red or green color ink. In record writing and data entry also, we should not use correction tape and vary our signature. And then don't write a confusing number, for example the number below, as we cannot identify the number. It is 27, 29 or 2%. And when we put a wrong data and we need a correction, we should just cross the data and write the correct data with the time that data is corrected. Document and records, how they differ. Document is a communication information via policies, processes, and procedure. However, record is a captured information on worksheet, forms, level, and charts. Document is an approved instruction either in paper or electronic form which guides about how an activity shall be executed, while record provides evidence that activities have been performed or results have been achieved. In document, it needs a regular updating, while record is permanent and we cannot change. In document also, we can be revised and edited, while records cannot be revised and edited. The last one is, in document, it is do not act as evident, while records is act as evident. And we can simplify that all records are documents, but not all documents are records.
So now we proceed to example of documentation in which involve the documents and record. So the first example is quality manual documentation. So a global company document that describe in paragraph form the regulation, rules and responsibilities carried out by the company and various parties that form the pharmaceutical industry. So in this quality manual documentation, it should contain the quality policy, scope of the QMS, pharmaceutical quality system processes, and also the management responsibilities. So this is the example of quality manual documentation. So from this slide, we can clearly see that it has the quality policy, which involve the vision, mission, and also strategic direction, and then the scope of the quality management system. So in this scope, it should contain the what part of the organization does, and also the quality management system and its processes. So from this, it shows the key activities such as purchasing, goods in, manufacture, and testing. So proceed to the next one is standard operating procedure. So SOP is a step-by-step instruction for performing operational tasks or activities. Any modification from a given SOP should be thoroughly investigated and then be documented according to the internal deviation procedure. So every changes in the SOP should be documented. So the guidelines to prepare SOP is that we need to have a clear and descriptive title to each SOP so that everyone know what is the SOP about. And then it should provide sufficient details, and any flexibility should be written in the SOP whenever appropriate. So next is organize the SOP according to the order of sequence of event involved in operation. Write the text in straightforward and easy to follow manner. Take into account the instruction from the manufacturer of the equipment, and also indicate total of number of pages and the effective date of SOP. So everything in the guideline of a SOP, it should be clearly stated so that it can be easy to follow. So from this slide, we can see the standard operating procedure example of the document. So from this, we can see it has a clear and descriptive title for the SOP, and then it also have the sufficient details, and the SOP is organized in order. Then it also has the date and also has the number of pages. Okay, next we proceed to the equipment cleaning and use record. So this record is about a record of major equipment use, cleaning, sanitization, sterilization, and also maintenance. So in this record, it should contain the date and time, process step, product and batch number, cleaning method with details of who performed the cleaning, maintenance activities with detail of who performed, as well as the status before and after the maintenance, and also repair activities. So this is the example of a record. So from this, we can see that it states the equipment or area that need to be cleaned, and then also have the check and verify on. So this one is should be provide the date on whenever the equipment is checked. So in this record, it also state that the date, where the area should be cleaned, and also cleaned by cleaned by and checked by, and also the remarks. Okay, now proceed the raw materials, intermediate, API labeling, and packaging materials record. So this record should maintain including the name of manufacturer, identity and quantity of each shipment of each batch of raw materials, intermediates or labeling and packaging materials, and the date of receipt. Inspection and test, as well as the status of incoming materials, such as the record tracing the use of materials, the documentation of testing and review for conformity with specification, and the status, which is either it approved or rejected. So the master choose a proof label should be maintained for comparison. So next is for batch production and control records. It should have the date, identity of the equipment used, specific identification of each batch of raw materials, including the weight, measures, and batch number, any sampling performed, the signature of person who execute critical operating steps and person directly supervising or checking, result of in-process control and laboratory tests, the actual yield in the corresponding phases or time, if applicable, a, a representative label of the API or intermediate, if this is a commercial scale, any deviation noted, it associated evaluation and investigation, and also the results of release testing. So from this example of record, it has the title of batch manufacturing record. Then also have the product details, signature of person who executed. Next is the raw materials, specific identification of the raw materials, which include the mass, quantity, measurement, and batch number. And then also has the processing equipment details. And then also have the production procedure, and also in this document it also show the yield calculation here. Okay, next is laboratory control record. So this record is all calculation performed in connection with the test, including the unit of measure, conversion factor, and also equivalency factors. So in this record, it should contain the signature of the person who performed each test and the dates the test performed. The date and signature of a second person is reviewed for accuracy, completeness, and also compliance with established standard. And in this record, it should be maintained for any modification to an established analytical method, periodic calibration of laboratory instruments, apparatus, GOTS, and recording devices, all stability testing performed on APIs, and also the investigations. So in this record, it also need to include complete data derived from all tests conducted to ensure compliance, such as the material name, batch number, date of sample, the quantity, and date of sample was received for testing. And then it should have a statement or reference to each test method used, a statement of the weight or measure of sample used for each test as described by the method, and also have the graph, charts, and also spectra. Okay, proceed to the case study. So Armedia helps Kita Pharma Incorporation in completing document management system update and stabilization. So what Kita Pharma Incorporation faced is that the document management system at Kita inherited was an older version of Documentum with a custom overlays called PDocs. So this PDocs is a software environment for electronic documentation, authoring, and also consulting. So what they face is that when they use an older version of Documentum, the system became unstable and ultimately would not start. For the client, it was a situation that required expert knowledge and quick action. So the SOPs are in a constant state of change. They must be kept up to date when there is a change in the manufacturing process or when new products are introduced. So they need a company that not only understood the software, but also the compliance regulation and critical nature of the problem. So what Armada do is that they perform troubleshooting on the server, databases, and network and brought the system up cleanly. So when the system was back up and running, it still required further activities to stabilize it in the long term. So So from this case study, it shows that documentation is a very important to keep up to date so that the system is stable and reliable through times. So that's all from us. Thank you.